Okay, I did Quetiapine, and the formula is C21H25N3O2S. The molar mass is 383.5099 grams per mole, and the common brand name is Serquel, and that's the IUPAC name. That's the structure. I can't see it. Alright, but the uses, schizophrenia, bipolar disorder, and it can also treat major depressive disorder when taken with an antidepressant. And it's an atypical antipsychotic, which means that it can treat both the positive and negative symptoms of schizophrenia. And it has less side effects as the old ones. And it has two different formulas, the extended release and the immediate release. And the immediate release was approved by the FDA in 1997, and the extended release is kind of newer, so it's 2007. And the extended release is for the acute and maintenance treatment of schizophrenia, and it's taken once a day with a faster dose titration and a sustained drug exposure. Side effects, the less serious ones are drowsiness, dizziness, weakness, and joint pain, and some that require immediate medical attention are fainting, seizures, uncontrollable movements, tongue sticking out, which is why I have a picture, and painful erection lasting 4 hours.
What drug is this?
You realize it's not
Painful.
Yeah.
Not pleasant.
Look, if you don't
Pain
have,
is my pleasure.
I'll talk about this later.
No, it's not.
Yes, let's talk
Oh,
about it now.
Later.
Got it.
And the historical alternatives is Quetiapine, and it was used in the 1960s, and it treated both the positive and negative symptoms of schizophrenia, so it was the atypical antipsychotic, and it was a lot like Quetiapine, and it was the first atypical antipsychotic, but it resulted in ankylosing, which is a condition in which the bone marrow does not make enough neutrophils, which causes vulnerability to infection, and so it was removed from the market in 1975. But it was eventually remade, I think, and then it's back on the market. But it's only used to treat schizophrenia when no other medications work. And then the history, it was synthesized at AstraZeneca, and it has structural analogy to Quetiapine, but the molecular discrepancies result in the lack of the androcytosis. Pharmacodynamics, it binds to alpha-1 and alpha-2, adrenergic and histamine H1 receptors. And the effectiveness in treating schizophrenia is because the dopamine type 2 and the serotonin type 2 antagonism. And it antagonizes serotonin activity and reversibly binds to dopamine D1 and D2 receptors, and that leads to decreased psychotic effects. And pharmacokinetics, it's absorbed after 1 to 2 hours. Food does not have much effect on absorption, so it's recommended to take it either with no food or little food. And the apparent volume of distribution is 6 to 14 liters per kilogram. And the mean terminal half-life of about 7 hours, and it's metabolized by cytochrome P450, 3A4, and excreted mainly through urine. Mechanism of action, the exact mechanism is unknown, and the effect of drug could be due to its ability to reduce dopaminergic and neurotransmission in the mesolimbic pathway, and it does not cause sustained elevations in serum prolactin concentrations, and it's unlikely to produce adverse effects. The synthesis, and I put it in quotes because I just copied and pasted and I don't really know what it means. How do you say that?
This is going to be a fun slide for you.
Amide is converted to the 11-fluoro derivative of phosphorus oxychloride, nucleophilic displacement of the halogen by 2,2-hyperethanol yields the product, which is the base, and the salt is prepared by mixing saturated solutions of the base in fumaric acid and catechol.